Hi class, my name is Olga Tansy. I'm here to give a speech, and the purpose of my speech today is to inform you are on shaken baby syndrome. Today I'm going to be talking on three main points about shaken baby syndrome. First, I'm going to take you through the causes of shaken baby syndrome. That is to say, like what you actually see on a baby that makes you think the baby has been shaken or violently dealt with. Second, we're going to talk about the diagnosis. And third, we're going to talk about the prevention or ways to prevent the baby from contracting the disease or to reduce the impact on the baby. First of all, I'm going to define what shaken baby syndrome is. Shaken baby syndrome is a disease that a child gets when the child is violently shaken by the caregiver or by the babysitter. This was coined by Health Canada magazine in 2001. I would like to let you know that this disease, the reason why I chose to inform you about this disease is because this disease is the leading cause of death in infants under 2 years old, according to Nangwaka and Conway in their report of 2004. It is it is a term used to describe how a baby is violently shaken and the constellation of the injuries suffered by the child, but also the way in which the child is injured. The main cause of the injury is the severe rotational correlation that happens in the child's brains. Like sometimes the most common cause is when the adult holds the baby from their tonsils and shake them so violently that their chin hit their chest and form fluid in the child's brain. In shaken baby cases, the severe forward and backward movement that the baby experiences is what actually caused the child's head to strike the spine. This travels in a rotational movement, side to side and forward and backward. Fractures in the skull, long bones, and ribs may also occur. occur. These are often an indication that the child has not only been shaken but has been impacted against a hard surface. That means sometimes it doesn't only occur when the child is being shaken, it can also occur when the child is hit against a hard surface or when the child is whipped by the mother or the caregiver. It was reported At first, it was reported by the Association of Babies between suffering from long bone fractures and subdural hematomas was in 1946 from an American pediatrician and radiologist, Dr. John Caffey. 25 years later, in 1976, Butchker, a British physician, suggested that subdural bleeding was caused by extreme whiplash, forcing the child's tiny bridging veins to transport blood to the child's brain, thus causing the child to have the disease. To describe an infant who has subdural trauma, in 1984, Ludwig and Wormer introduced the term shaken baby syndrome in their study of infants who had been shaken but showed no external trauma. Like you couldn't tell from seeing the baby that they have been shaken. The main cause is the severe rotation that the child's head rotates from one side to the next. When you shake a baby, and stuff. In 1860, Theodore reported the thickening of blood in the surface of the brain in Parisian children who were victims of child abuse. That's to say, child abuse is also a cause of shaken baby syndrome. Like if you abuse a child, depending on where you hit the child, it can lead the baby to have shaken baby syndrome. Also, in 1971, Goodkelch, a neurosurgeon, reported subdural hematoma as a fracture of the battered child syndrome and postulated that the brain injury was caused by shaking. He wrote that, I quote, relatively large head and pony neck muscles rendered the infant vulnerable to whiplash injury. He also noted that good shaking was felt by British parents. So shaken baby syndrome is difficult to diagnose. A couple ways were used, to diagnose to find out when a child actually has shaken baby syndrome. The two recent British surveys indicated subdural hemorrhage in the child's brain. They actually indicated that 21.0 and 26.6 per 100,000 children under 1 year old had shaken baby syndrome. Most children were aged less than 6 months. This was reported by Showers in his 1992 article. It is difficult to diagnose shaken baby syndrome except if the parent really clearly explains to the physician what happened to the baby, since most parents, are ignorant and they actually do not know that shaking the baby, even trying to put the baby to sleep or shaking the baby trying in an attempt to stop the baby from crying actually cause the baby to have shaken baby syndrome. So to diagnose shaken baby syndrome, most physicians look for hemorrhage, retinal hemorrhage, that is bleeding in the retina of the eye. That is a possible way that you can tell if a child has been shaken or not. Also, there are two ways that can be used to diagnose shaken baby syndrome. They use the computed tomography, CT, and the magnetic resonance imaging. But nowadays, in most cases, they rarely use these because it is quite expensive and an average parent cannot afford, to get that. Some ways to prevent shaken baby syndrome. Some ways have been suggested to prevent shaken baby syndrome. First, it has been suggested that medical attention can help prevent the impact of babies being shaken, but children are left with the permanent damages that are caused by the shaking. To further prevent the syndrome, Dr. John Caffey, who first described shaken baby syndrome in 1972, called for massive public educational program to describe the dangers of shaking an infant to the parents. Parents should also receive information on the dangers of shaking their babies, and they should make sure they go for immunizations when the baby is like 2 months old, to the hospital to immunize the babies against any bleeding in the retina or any fluid in the brain. You know, in conclusion, you know, after what we have said today, you now know the causes, the diagnosis, and the ways to help you prevent your baby from contracting the shaken baby disease. This is a very dangerous disease because children are gonna, even though it is going to be treated, even though it would be treated, the children would stay with the damages are permanent. Like, it cannot be treated, it can only be stopped, but the child still suffers from the damage. So parents should make it a point of interest to get information from hospitals. Caregivers should know the dangers of shaking, slapping, or impacting their baby's head against a hard surface, because these impacting and shaking cause injuries that the child may live with forever. Thank you.